Hello, other denture family. It's me again. Just a quick update before I get into the subject of our video, which today is going to be the use of antibiotics with our tooth extractions and immediate dentures. I did a couple of weeks ago have my soft reline done. I think I mentioned that in a previous video. And the uppers, where I do have suction when I put the uppers in that I don't need adhesive, they do not stay in when I try to eat. So they pop down and pop out and rock back and forth. So I do have to use adhesive. I don't have to use much. I just use a little bit of powder adhesive, or I use the Adhesident just a little bit, and it helps stay it in a while so I can eat. The lowers, she did not adjust them as I had asked when I told her I had this sore spot up front here. It was on this side right here. So I had put in a snug up application of Denture Fit, and it helped with them fitting better, but it didn't help with the sore spot. So I took the Denture Fit out, and I took my Dremel to it, and I whittled it down just a teensy little bit. I just didn't need much, maybe a millimeter if that, and it works great. I put in another snug up application of Denture Fit, and they're so cushy right now. I don't need adhesive on the bottoms when I try to eat, unless I'm eating something that is really bad about getting underneath there, like chips or nuts or something like that. So the only time I find, I'll just have some chips. So anyway, as long as I'm not, if I'm eating just a regular meal like a sandwich or steak or something like that, I don't really need adhesive. They don't really rock back and forth much. Just things get underneath there, and it's extremely painful and uncomfortable when I try to eat, and stuff gets underneath there. So to prevent that, I will use adhesive before I eat something like that. So anyway, to get into the subject that I wanted to talk about today, and that is the use of antibiotics with your multiple extractions and immediate dentures. Now, just recently, or the past few years, I think the last time was like in 2016, the American Dental Association, American Heart Association, and the Orthopedic Association made some changes in their guidelines to using prophylactic antibiotics with dental surgery. It used to be that if you had a prosthetic joint replacement, such as a knee replacement, that they would recommend antibiotics with that, and they do not recommend that anymore. Certain heart conditions, let me see if I can pull that up really quick. So if you see me looking off to the side, it's because of reading my notes. It used to be there were multiple heart conditions that they recommended that you have prophylactic antibiotics for, and see if I can find that really quick. Generally, if you had a valve replacement or a type of valve surgery that you've had any kind of prosthetic used in that valve repair surgery, or a history of endocarditis, anything like that, they do recommend you get prophylactic antibiotics with that. But there are other heart conditions that they don't recommend that for anymore. What happens is that with the heart conditions is that your extractions, that bacteria from that can get into your bloodstream and go into your heart and cause something called infective endocarditis, which is an infection of the lining of the heart, which can be life-threatening. I think I mentioned that particular thing in a previous video. So with those particular situations, they're not recommending that you have antibiotics anymore, except with certain heart conditions. Now, they do recommend, if you're having a simple extraction like a tooth pulled, they don't necessarily recommend antibiotics for that anymore, and I'll tell you why in just a moment. But anytime that you're messing with gingival tissue, or like, for example, root planing or multiple extractions due to periodontal disease, anything like that, it is recommended that you get a round of antibiotics either starting before and have them during continue to take them after the procedure. That is recommended. What antibiotics? Antibiotics are medicines that are used to treat infections, not viruses. Infections and diseases that are caused by bacteria. So what happens is antibiotics get in there and they either kill off or fight off or prevent bacteria from multiplying in certain situations. And there are broad spectrum antibiotics that will kill or treat a multiple bacteria, and there are some antibiotics that will only kill a certain few. And what happens is that if you have antibiotics too often, two things can happen. The two major risks of antibiotics in dentistry especially is you can develop an allergic reaction. It is common for people to have allergic reactions to, for example, penicillins and sulfa medications. Those are probably the two most common that I can think of having reactions to. And in order to get a reaction to a drug, you have to be exposed to it. So the first time you take something, you may not necessarily have a reaction, but the next time you could have a reaction which can range anything from hives or a rash to a serious anaphylactic reaction, which you would need immediate medical care and possibly a medication. Blanking on the name of it right now, I'll probably think of it in a minute. Epinephrine. You would probably need a dose of epinephrine to treat that. Another thing that is commonly used to treat, well, I probably better not say that, but we'll get into that. Anyway, another thing that can happen with chronic or frequent use of antibiotics is antibiotic resistance. And what happens is that the bacteria in your body change so that the antibiotics that you're taking no longer affects those bacteria, so that it leaves you more vulnerable to more serious infections. And antibiotic-resistant infections that are caused by antibiotic-resistant bacteria is extremely hard to treat. So generally, it's important to avoid unnecessary use of antibiotics. Now, that doesn't mean that if you have multiple extractions, you don't need a round of antibiotics. When we have periodontal disease, that is caused by an infection that gets in your gum line, and it causes your gum loss, your bone loss, and your tooth loss and your tooth to decay. So a lot of us have pockets of infection in there that we may not necessarily have any symptoms of. And what happens is that bacteria, when you have multiple extractions and have alveoplasty, something like alveoplasty, that infection can get into your bloodstream, and it can cause multiple problems, a septic infection. And I do know of one gentleman that did not get antibiotics after his extractions, and he did end up in the hospital with septic infection and had to have IV antibiotics. So one of the most common complications of multiple tooth extractions, of course, is an infection. So because our mouths are full of bacteria. So the dentist can decide whether or not to give you antibiotics after your tooth extractions or beforehand. Like I said before, for simple extractions, antibiotics generally aren't required. But if a patient is having your gum tissue messed with or something like that, then you probably need to get a round of antibiotics for your extractions. And the symptoms generally of an infection would be acute pain. Now, obviously, if we're having extractions, we're going to have pain. And usually day 3 is probably the worst day for most people, day 3 or 4. But you can have serious acute pain. It's just really all of a sudden throbbing, really, really bad pain. You can also have redness and swelling and drainage from the infection sites, from your extraction sites. If you end up with a dry socket, that can lead to bacteria getting in those sockets and causing infection too. So also another, if there's bleeding that continues longer than 48 hours after your extractions, you're probably developing or have an infection. So you need to immediately call your dentist and get some antibiotics going. Fever and chills is another symptom of that. If you've gotten to that point, you probably need, if you can't get a hold of your dentist immediately, you might need to go to the ER and get that checked out, just to be safe, okay? But anyway, that's pretty much it. I'm checking my notes over here to see if I've got anything else and I've forgotten it. There is not a whole lot of data out there. I have researched and researched and researched. There is not a whole lot of data out there, or studies have been done on the prophylactic use of antibiotics. The American Dental Association, of course, has, like I've said before, has changed their recommendations on the use of antibiotics. In simple extractions, they're no longer giving antibiotics for that. Joint replacement, they're no longer giving antibiotics for that. Some heart conditions, they are no longer giving antibiotics for that. Some require it, like I said, because if you have a history of endocarditis, valve replacement, that kind of stuff. You want to check with your dentist, make sure that they know your medical history. And if they're going to give you antibiotics, try to get that prescription and get it filled before your surgery so you don't have to worry about that afterwards. So I think I had my appointment was on Monday afternoon, and I called them on Friday and went in on Saturday to finish signing up the paperwork on my extractions and my surgery. And also picked up my prescriptions for my Halcyon, my antibiotics, and my pain pills. So I had all those filled Saturday afternoon. I went ahead and started taking my antibiotics on Sunday. And make sure that if you are given antibiotics, that you take every single solitary one of those pills. Don't feel better after 5 days and then, oh, I don't need the other 3 or 10 days, 3 or 4 days worth of antibiotics I have left. Take them all. Because if you have an infection going on in there and you take 5 days worth of antibiotics and you're feeling better and you feel fine and there's nothing going on, what can happen is that it has slowed down the growth or stopped the bacteria from growing, but it hasn't necessarily killed it all. So if you stop taking your antibiotics, then that bacteria can start multiplying again, and you can develop an infection or redevelop that same infection if it flare up that you've had if you don't take all of those antibiotics. Okay? So that's all I've got for today. I just really thought this was an important subject, especially after speaking with a gentleman. I do want to seriously thank Imwal for sending me that extra tube of denture fit that she had so I could do that other snug up application here. Thank you so much for that. That was wonderful. Bless you. I really, really, really appreciate it. I do also want to mention a couple of things too. Donna Sloan just gave away 3 sets of brand new dentures. Congratulations to those ladies who have won. My Beautiful Smiles channel is also doing a Joe's Denture Lab giveaway on a complete set of standard dentures. She's also going to have a first and second and third runner-ups, which are going to receive a tube of thing of denture fit and a set of Dr. B's kit with the adhesive dent, cleaner dent, the cleaning crystals, and the sonic cleaner. So you want to make sure that you hop over to these channels. Check these channels out mainly. Donna Sloan, Margaret, My Beautiful Smile, and Caleb. These ladies are doing a lot of giveaways. And I did mention before that I was going to give away this complete set of Dr. B's kit once I got to 200 subscribers. However, I have changed my mind on that. I will be doing a giveaway on that complete set probably this coming week. And I will upload the details for that. Probably, I've got a super busy day tomorrow, so it'll probably be Tuesday, and I will upload the details on that particular giveaway. I already have the set here. It does not include the cleaning, it does include the cleaning crystals, but not the new liquid cleaner that they have for that, because I got the set before they switched over to the new crystals. Now, these cleaning crystals are still just as good as they were before, so make sure you keep posted and keep watching my videos and be on the alert for that giveaway video. All right, that's all I got. You guys have a wonderful day. God bless, and I'll see you next time.